Another 563 people have died in the UK after testing positive for coronavirus, bringing the total number of deaths to 2,352. The deaths happened in the 24 hours before 5 p.m. on Tuesday, the Department of Health said. It is the largest increase so far. The number of deaths in each country is: Scotland, 16 more deaths, a total of 76. Wales, 29 more deaths, a total of 98. England, 486 more deaths, a total of 137. Northern Ireland, 2 more deaths, a total of 30. NHS England said those who died in England were aged between 13 and 99 years old, with 20 of the 486 patients, aged between 13 and 93 years old, having no known underlying health condition. England's Deputy Chief Medical Officer, Dr. Jenny Harries, said on Monday she was anticipating the number of deaths to get worse over the next week, possibly 2 before they decline due to people adhering to the lockdown and social distancing measures. The Department of Health said 29,474 people have tested positive for coronavirus in the UK as of 9 a.m. on Tuesday, 4,324 more than the 24 hours before. NHS England's National Medical Director, Professor Stephen Powis, said there were some green shoots with the number of new infections hitting a little bit of a plateau. He said even if that was sustained, the number of deaths would continue to rise for some time to come. It's early days, we're not out of the woods, we're very, very much in the woods, he said. Pressure is increasing on the government to increase COVID-19 testing after ministers claimed last week a target of 10,000 tests per day had been hit, when only around 8,000 are currently being carried out. Frontline NHS workers have expressed frustration over being forced to self-isolate when they are most needed, because tests are not available to show whether they are clear of the disease. The Prime Minister's official spokesman said more than 2,000 NHS staff have now been tested. There are about 500,000 frontline NHS staff. We're very clear that we want more testing to be carried out, and that we are working with NHS England, Public Health England and others to ensure that happens.